Welcome to Cutera Experts Corner. In this edition, experts discuss Cutera's truSculpt Flex and truSculpt ID. If you've missed other episodes in this series, you can access them online at modernaesthetics.com. Dr. Jeffrey Dover of Chestnut Hill, Massachusetts, outside of Boston, moderated a discussion about the use of unique technologies in practice. Experts touched on diet, exercise, the role for truSculpt Flex, and the truSculpt ID from Cutera. Dr. Nina Desai, board-certified family practitioner from Sugar Land, Texas, talked about how she uses truSculpt Flex to expand treatment options.
It has actually changed the way we recommend body contouring. So we live in Sugar Land, which is a suburb, so I have lots of busy moms that try to get to the gym, eat healthy. When we had ID, we were seeing fantastic results, but Flex has definitely improved that. So what I normally recommend, because we see such a great improvement with Flex almost immediately, whereas with ID, they do have to wait a few months, it's encouraging them to do the combination treatment. So with Flex, we're seeing a little bit more of that temporary contraction of fat kind of almost immediately to give them a nice shape to their abdomen, and overlapping that with ID now, which then they will see the permanent fat reduction a few months later. So we're seeing a great result with the combination, and a lot more women are starting to get on to this combination therapy. We also have seen an influx of male patients that are starting to become avid flexors in our office, just because they're encouraged by what they're seeing in their abdomen, especially as they're aging. So it has been a great addition to our office.
Tell me how you do the two. Patient comes in and you know they would benefit from both. What do you do in what order? And do you do them all in the same day?
Sure. So we normally recommend doing Flex and ID in the same day, at least for their first visit. I will ordinarily, for the first time, we'll do the ID first, and then we'll Flex on top of it in the same day. And then we have them come back about every 3 to 5 days to do the Flex for their subsequent treatments. We usually recommend about 6 treatments for the Flex, and then we have them wait about 12 full weeks. And then we take those pictures, and then we recommend a maintenance program.
Dr. Dover asked Dr. Arash Moradzadeh about demand for treatment among both men and women.
I definitely think that both treatments, truSculpt ID and Flex, are very popular with men and women, and they're pretty much equal for me in my practice. And a lot of times if a woman comes and does it, the minute she gets her result, her husband is coming in to do it as well. So it tends to just have this cascading event where once someone gets their result, especially with the combination, most of their friends are going to come in and get the same thing done too.
And tell me about how you do it. You see, let's say a fella comes in, 45 years old, he goes to the gym, but he wants to look better. And you think, gee, he'd do well with truSculpt Flex and truSculpt ID. Do you do them on the same day, and in what order?
Yeah, so I always discuss both treatments during the consultation so that they can make the appropriate decision for them based on their goals and their body type. And they understand that the combination provides a more accelerated and dramatic result. And then when I originally started to pair them together, I would do truSculpt ID and then immediately start their first Flex treatment. And I would do 4 treatments on average after that. But from what we've understand more and more as we've been doing these is that once you do your first 2 tone modes with the truSculpt Flex, the last 15 minutes of each of those sessions actually starts to increase and rev up your basal metabolic rate. So your metabolism is going to start to go up, and then those 2 sculpt modes are really going to push it into that high metabolism level. So what I do is that I will do the 2 tone modes, and then I will do the truSculpt ID with their first Flex on that 3rd appointment with the sculpt mode, and then there is a 4th sculpt mode. So I'm commonly doing tone mode, ID, sculpt mode is how I'm doing it now. And then there are some situations where I may do a 6-pack of the Flex treatments, but on average, because my patients are already exercising a lot, we do the 4 treatment sessions.
Got it. And I presume because you're getting to an aerobic state in some of these patients that you might be affecting visceral fat as well.
Yeah, it's very interesting. When I first started doing the treatments, I was a little more picky about who is a good candidate, especially with truSculpt Flex, expecting that if you're going to see a result, for example, in the abdomen, they need to have a low level of abdominal fat or visceral fat to show the changes. But what we're actually seeing is, because we're simulating aerobic exercise and we're increasing that metabolism for 14 weeks, that we're getting a dramatic reduction in visceral body fat. And those guys that usually have that firm pot belly, that it's actually reducing, it's not so firm, and you're surprisingly seeing a lot of that muscle toning and sculpting.
That's very impressive. And so are you seeing any weight loss with this loss of visceral fat, or is it more turning from fat into muscle? Not turning, but you
Yeah,
obviously don't turn fat into muscle, but they're getting more muscle and losing fat at the same time.
I think that it varies from patient to patient, but most of my patients lose a lot of weight. I personally lost 7 pounds and started to eat more because I'm naturally underweight and was scared that I'm going to lose too much weight. So that's
Well,
my
you're
own
very
personal
small to
experience.
start with, so 7 pounds for you is a lot.
Yes, so it was a lot for me. But most of my patients love it. And I actually do this program. Those who I know they're looking and trying to lose weight, and they tell me about how they're having a hard time. They've hit a plateau. They lost their first 5 pounds, for example, after the pregnancy, and it just stopped. Like they're stuck. So for those patients, I actually have them do the truSculpt ID and Flex like we've discussed, but they start a keto or intermittent fasting diet on the day that we do their first treatment. And for those patients, anecdotally, I can say that most of them are dropping about 5 to 7 pounds in the first week. And then a certain amount of weight loss occurs after that, with an average about 15 to 20 pounds.
That's amazing. Now, it is interesting that for years doing body contouring for fat with the ID and other devices, I expected patients to lose weight, actually quite a bit of weight, but we didn't see that much weight loss. And I thought they would lose weight for two reasons. One, they're investing all this time and effort to improve their shape. So you'd think that they would also probably be eating better or differently and they would lose weight. But in fact, in the formal studies and in the real world, they haven't really lost that much weight yet. When you do truSculpt ID for fat and then the flex, and it's maybe that aerobic conversion, that's when, as you've seen, we've seen the same thing. We start to see patients becoming more fit and losing weight. They're actually eating better, as you mentioned, keto diets and things, and they may be working out more. But it is sort of interesting how the flex I find is almost addictive, where the ID is
Yeah,
not. I started off with 4 truSculpt Flex, and I was supposedly done, and I couldn't stop. And
yeah.
I wanted to do other areas, and I wanted to go back to the same area. And going to the gym, my trainer said, what have you been doing? Like, how come you can do all these exercises? You couldn't even do them 2 weeks ago. And it was quite striking. Within 2 weeks of starting, I saw the improvement. Nina, have you seen such rapid improvement in your patients?
Absolutely. I have quite a few patients that are women who are really active over the age of 60. They're, telling me how much they walk or they do crunches. They still go to the gym. And so we started them on Flex. And after the second, third treatment, they were letting me know that they felt stronger, that they were able to do more crunches, sit-ups. I have a lot of women who do Pilates and they're able to plank a little bit longer. So it was very impressive at the strength that they gained after the Flex treatment. So we have seen quite a bit of that. And it is addictive. I agree completely. Not only for myself, but even the patients, we don't have a problem with them returning, doing their maintenance treatments.
So you brought up maintenance. So let's go to that. Tell me how you do this. Let's say you do the 6 that you recommended. And then the patient says, well, Dr. Desai, what should I do now? I'm eating well, I'm exercising. I know this is not a replacement, but I can't sit on the couch and watch TV and eat chips all day long. Well, I could, but I shouldn't. But what do I do now? Like, do I have to keep coming every twice a week, or can I come less often? What do you say?
So I definitely encourage them to have this be their motivation to get in some sort of program if they've not already been in one. Otherwise, my rule of thumb is usually if they are physically active, I recommend possibly an every 8 to 12-week treatment on the areas that we've been flexing. If they're not active, then I let them know that they're welcome to come back as a monthly type of exercise program. But again, I'm still always encouraging them to at least pick up yoga or Pilates or some sort of aerobic activity, even if it's just walking outside, just to get them encouraged to do some of the activity on their own. But that's sort of the protocol we've adopted in our office.
Nina, this is very important. Let's repeat that. So if they're not in a regular exercise program, you'll have them come back for maintenance every month. But if
Correct.
they're in a regular program of some sort, maybe every 2 to 3 months. Is that right?
Correct. Yes.
Now, what if someone says, look, I love doing this. I want to come every week. Can they do that if they can afford it?
Absolutely. It is very safe to do. I let them know that that is a choice of theirs if they'd like to. We're happy to see them every week. We let them know there's no limitations. More often than not, what happens is once they've done an area, they will normally move on to another area. So as they're coming in, the best part about Flex is we can treat more than one area at a time. So a lot of times they'll add either their quads or their gluteal muscles if they've done their abdomen before. And so we'll sometimes just tack on if they're coming on for other treatments, just go ahead and maintain that for them when they come in, and then put them on a maintenance program after that.
Fantastic. Let's make it very clear that the truSculpt ID produces permanent fat reduction. The studies show an average of 24% fat layer reduction from the treatment, and it's permanent. Those fat cells are permanently destroyed. It's adipocytolysis. The cells are gone and they don't repopulate. But with Flex, while you tone the muscle, it's like anything else. When you stop going to the gym or stop working out, you slowly but surely or more quickly lose that tone. So there is maintenance required for truSculpt Flex, but not for the Cutera truSculpt ID. Arash, tell us about what sort of muscle building you can expect to tell a patient about with the truSculpt Flex.
Yeah, when I'm talking to my patients about Flex, I let them know that on average, they're going to see 30% increase in muscle mass with a 4 treatment protocol. And that's a pretty impressive change that they're able to see. And that visually, it's going to range based on their body type from looking very toned and firm to possibly having a six-pack that they've never had before.
Now, I noticed that your protocol is usually 4 treatments up front and Nina's is 6. Does it matter? Is it basically up to the individual provider?
Yeah, and I also think the more treatments you do, the better your results is going to be. So I think 6 is more than 4.
You have a more physically fit population,
Correct.
as you mentioned, Dr. Moradzadeh. My population is not always as physically fit. So I do include the prep mode, which is the conditioning mode, to make sure that I'm kind of warming up those muscles per se, but also conditioning, because a lot of my patients are not active on a regular basis.
That's a very important point. Now, the prep mode is my favorite, having tried them all, because it's the least aggressive. But I tell you what, you do not fall asleep during this procedure. In fact, I tried doing emails and I can't do emails in the tone and sculpt modes. I can barely in the prep mode. But once it shifts, suddenly your hands start to shake. As Rush said, you're getting into aerobic activity. It's sort of like running on the treadmill. It's very hard to do text if you're actually running on the treadmill. Walking is one thing, but this is actually like a vigorous workout. When you're done, you're tired.
Yeah, 54,000 contractions is a lot of work.
Absolutely. Most of my
really
patients, they break a sweat. I mean, I usually break a sweat when I'm on the device as well. So it's definitely a
It is
workout.
interesting. The other thing we've learned of late is originally the device was used mostly, as you described, Nina, for toned, fit gym types who want to look even better. But it turns out that normal people are probably the ideal candidate for this procedure, in my estimation, because the device goes right through the overlying fat. So even if they've got, let's say, 25% too much fat over their belly, the Flex goes right through that fat and tones the muscles below. You do not have to have a 4-pack ab going for a 6 to be able to do this. Would you both agree?
Absolutely.
Yeah, I definitely agree. It's everyone's a candidate type of treatment.
Yeah, so unlike truSculpt ID, where if you're really too fat, unfortunately, and you don't have pockets of fat, but you have one giant area, you really need to lose weight before it's going to work. But in this case, it works for just normal Americans, and most normal Americans are actually overweight and not that toned. But we think that that might be the next big horizon for this device, is to just treat normal individuals to get them going. I think it would be a great thing to do in combination with your local gym and say, if you've got a new program for never been to the gym or afraid of the gym sort of people, they're perfect for Flex 6 times while they're starting a new program. They'll just zoom ahead of everybody in the class. Talk about a great way to sort of cheat, but in a nice way, don't you think?
It's a great idea.
Definitely.
Yeah, any final comments that either of the two of you have to guide our listeners on how best to accommodate these two new practice builders into their practice?
I think my biggest tip would be don't stereotype or assume that it's for a specific person or its patient type, because it's actually really for a very large audience and ones that you're not thinking of. I have so many patients who've had cervical or lower back spine surgery who are coming in to build core strength, and it also allows them to do something during that period after surgery where they're not allowed to exercise, and they're seeing dramatic improvements in their issues as well. So don't think of it as just a cosmetic tool, but it's a total body improvement tool.
That's a great tip. Nina, any final thoughts?
Yeah, I think my practice is heavily women, especially of childbearing age. So one of the things that we've really loved about the combination, and it's kind of accelerated our body contouring practice, is the fact that with the combination, we've seen a great deal of improvement in their skin quality, their skin integrity, especially women who have had children. And so, and you know, our metabolism is a little different than the male metabolism, and so just getting that increase in basal metabolic rate with the flex, and then permanent fat reduction with the ID, you know, it's customizable and we're able to shape women's bodies the way they're kind of wanting. And then, like I said, we're seeing a little bit more of that male population, like Arash mentioned, you know, it's the husbands get a little jealous of the wives looking better than them kind of coming in. So it's definitely a fantastic combination together.
Well, thank you. I think a couple of tips that I've learned from this incredibly informative discussion is number one, as Arash said, do not try and pigeonhole or guesstimate what patients can either afford or would like to do, number one. Number two, this is a great opportunity for rehabbing people after back injury or hip surgery or knee surgery to increase their muscle tone and help with fat if you're doing a combo while they're doing their physical therapy. So it's a great great for you to reach out to the physical therapists in your neighborhood, or especially personal trainers, and you provide a few treatments to the personal trainers, they go, oh my God, this actually works. Because they don't know anything about flex, by the way. You mentioned it, they think it's some gizmo that doesn't do anything, and when they see it's this very expensive, fancy device, it is very powerful, and you do it for them, they'll start sending in all of their clients. So I think those are two great opportunities.
The availability of the two technologies is a 1-2 punch, Dr. Dover says.
I think by the Cutera developing flex, it's going to make ID give even better results. And that's why we want to have this discussion with the two of you, experts in using the two technologies together, as opposed to just one or the other.
If you haven't listened to other episodes in the Cutera Experts Corner series, listen now. And be sure to listen to other new episodes focused on truSculpt Flex. You can also learn more by visiting Cutera.com. Thanks for listening.